As we continue our series on chemicals in warfare, today we're going to discuss a particularly nasty chemical known as mustard gas. So what is mustard gas? An important thing to know about mustard gas is that it's not just one thing. It's number one here. It's a family of what are called mustard agents. So this includes sulfur mustards, which is the main topic of today's discussion, and nitrogen mustards. I know it's a very odd term, but we'll talk about why it's called a mustard. There are many variations of mustards. In this case, the one that has been used in the past is this structure right here, bis-2-chloroethyl sulfide, or ethyl if you're from the UK. So this is a colorless, viscous liquid in its pure form. When it's used in warfare, it's not pure, it's pretty impure. The main piece here is that it's a blistering agent, or a vesicant. It's another term for it. And this is exactly what it means. It causes very severe chemical burns and blisters and boils. This causes very severe skin, eye irritation, oral nasal mucosa irritation, basically burning on the inside and the outside. Incredible pain, and it's a pretty horrendous experience to go through. So it's called mustard gas because the characteristic smell is mustard, garlic, horseradish. So this little graphic right here says smells like garlic, horseradish, mustard, strong, vesicant. Vesicant, as I mentioned before, causes blisters. And it has this characteristic yellow color to it, which is where the term mustard comes from. It was called other things when it first came on the scene, but as time went on, it garnered the name mustard gas. So it's been heavily used in the past, specifically World War I. We'll talk about that soon. A little over 1.2 million poisonings, about 100K poisonings in Iran and Iraq war in the 80s. It's been used across more recent history. It's completely banned for use in combat. It can persist for decades in the environment as an oily liquid, and there is no antidote for poisonings. But number two here is where we're really going to focus, because this property of this chemical is what really terrorized the soldiers that came in contact with it. It is banned. The development, use, production, stockpiling, and transfer of these weapons is completely banned. There is no purpose but war. So banned by international law according to the Chemical Weapons Convention. It can be deployed in a number of ways, like bombs, mortars, rockets, all sorts of different things. So here we see a picture, and we see these soldiers in this cloud of smoke. So they do have masks on. It looks like they're very crude gas masks. It's hard to tell. The issue with this, we'll discuss this soon, is that the gas masks are not as effective as you think. They do prevent inhalation of the gas, but the gas does seep through clothing, and it obviously will directly affect the skin that's exposed or not exposed. And here can be another use of mustard gas. It can be deployed through planes and through rockets. Now these rockets specifically are for sarin gas or UX gas, but I just wanted to show you an example of how this could be deployed. So how does mustard gas work? Well, mustard gas reacts with our DNA. So let's break this down a little bit. So number one here, what happens with the DNA is that the guanine gets alkylated. It's a complicated terms. Basically, guanine is a part of the genetic code. It's one of the pieces of DNA that makes up its structure. And alkylation is just adding a certain chemical group. So all this means is that it disrupts the structure of DNA, which can cause a whole lot of things like permanent damage, prevents cell division. It results in programmed cell death. It can cause cancer, which is the fate that many people who were exposed to mustard gas underwent. And this cancer-causing property will happen a lot later after the person gets in contact with the gas. So what happens? This sulfur molecule will essentially attack this structure. This chlorine will pop off, and it will form what's called a cyclic sulfonium ion intermediate. Basically, this is a sulfonium ion. It's kind of, this whole structure kind of sits between these two on the end. The issue with this down the line is that, as you can see, the DNA molecule gets integrated into this mustard gas compound. And this is what causes all of the issues, because now the DNA can't perform its proper function. And as living organisms, we need DNA for all of our bodily functions. Another piece of this interesting compound is that it is very fat soluble. Well, why is that important? Well, first of all, when we think about fat soluble, we mean that it, for lack of a better phrase, dissolves in fat. Think about salt as water soluble, right? It can kind of break up evenly in water. What I mean by this is that when mustard gas touches skin, which is full of fat, it absorbs very rapidly. Now, at the same time, in the cells, hydrochloric acid forms. So HCl is what makes up stomach acid and a whole host of things. It's very caustic. And this is where the blisters and burns come in. So overall, this is a recipe for deep and painful lesions or burns that are very, very difficult to treat. Now, this applies on the outside with the skin and on the inside. If you inhale enough mustard gas, you can cause very severe respiratory damage, edema, issues breathing. There are pretty horrendous journal entries of nurses on the field in World War I seeing soldiers crying and screaming because of the burns they were going through, but also choking because they couldn't breathe. This is a very nasty chemical weapon. It can also cause very, very serious eye damage. So the next few slides are going to be relatively graphic as far as the pictures are concerned. So if you're a little squeamish, then the last half of this might not be for you. The pictures aren't terrible, but I do want to show you guys what this chemical can do, just like I did with white phosphorus. So let's continue. So let's go through the gist of the physiological effects. So we talked about the vesicant, this blistering effects. The interesting thing about this is that they're not immediate. You could be a soldier walking around seeing this fine yellow mist in the air. You wouldn't think much of it because when it initially contacts the skin, there's not an immediate burn, but it is very, very powerful. I mentioned before that this can cause mutations and cancer. We talked about the changing of that DNA structure, which down the line can result in all sorts of issues, including cancer. So within 24 hours of exposure, the person can expect intense itching and skin irritation and pain and large blisters full of yellow liquid, difficulty breathing, and all sorts of issues. So here we have a picture of, it's not great quality, but you can see the burns, you can see the blisters and what it does to this person's hand. And then here you can see again the terrible effects. These guys have bandages all across their bodies, especially this guy has bandages all across his head because these are the pieces that were exposed to the gas. Now this guy right here either had no gas mask or a very crude gas mask, like goggles or a shirt over his face. But I mentioned before, it doesn't matter if you're wearing clothes, the mustard gas can seep through the clothes and still contact the skin. But if it does contact an exposed area of the skin, it will be badly burned. And I'm assuming this is what happened with these two guys and their faces and this guy and his hands. So there's this really interesting website I found that kind of gave a case study. In 1917, World War II in Ypres, Belgium, I think that's how it's pronounced, in West Flanders, one of the many places where mustard gas was deployed pretty heavily. I'm not a World War I or World War II buff in general, but what I do know is that we know that chlorine and phosgene gas was used, which would cause intense respiratory irritation. The Germans pretty much perfected that. But then you have this new compound in this incredibly deadly, bloody trench warfare, mustard gas. So you had these soldiers in this area who got exposed to mustard gas having no idea what it was. So as I mentioned before, you're walking around, you see a faint yellow mist in the air, And within hours, you have no idea what's going on. You think there's nothing much happening. Within hours, you have hundreds and hundreds of people rushing to the medical tents with burning and pain and irritation. No one knows what's going on. Eventually it was found that this gas caused these very intense burns. Here I found a picture. I think this is far more recent, but this is an example of the deleterious effects mustard gas can have on the eyes. Now, I believe from this picture, this is a pretty extreme example, but as you can see the incredible damage, you see that characteristic yellow color. You can see the eye is pretty severely damaged. Almost looks like there's like a cataract or a film over the eye. But as you can see, the mucous membranes, any exposed surface really gets burned up and damaged. Then we have an interesting picture here of some pretty crude gas mask. This guy looks like he's choking because of the mustard gas. I mentioned before that the irritation and the burning that happens outside can happen on the inside, especially as that gas comes in contact with these tissues. And this is a pretty terrifying reality of trench warfare in World War I. Much of this was very new, and you had to do what you had to do to stay protected. Then we have this is a particularly nasty picture of a soldier that has clear chemical burns, and this is all from mustard gas. This was a pretty terrible fate. Those who did die died within days to weeks of just suffering. There's no cure, so it's not like they could spray a solution on at this time or give them a medication. You had to treat it like normal burns. And if they inhaled enough of it, you experienced choking, incredibly intense respiratory burns, but also these terrible burns on the skin. And as I was reading these stories, it was pretty tough to read because it was just pure suffering for anyone who came in contact with this stuff. Some soldiers didn't want to go out on the battlefield because it was so terrifying. Then we have this guy. This is a more recent picture, I think, of an accidental exposure, but we see these yellow boils filled with pus and liquid, characteristic of mustard gas poisoning. And as I mentioned before, there's no cure. Well, there is solution that they have now that can be used to treat the wounds, but overall, it's a pretty terrible thing to go through. So you're going to have extremely painful and untreatable blisters, the arms, the leg, the torso, nasal and oral mucosa burns. All of these burns can be first or second degree, even worse depending on the exposure. Blindness can occur. In that picture I showed you earlier with the eyes, I believe that patient did go blind. Some people went blind, some people didn't go blind. Either way, it was a terrible thing to go through. Intense agony and disfigurement. A lot of people suffered permanent disfigurement from mustard gas. Respiratory burns that are again first and second degree, bleeding, blistering, choking, having trouble breathing. And gas masks only prevented the respiratory symptoms, and the clothing did nothing to protect the skin. The burns healed very, very slowly. And because of this, you had a risk of infection, sepsis, which could cause things to go downhill very, very quickly. And in the battlefield in World War I, it's not like they had this advanced medicine. You had what you had to try and treat wounds like gunshot wounds. But as people were exposed to this new type of warfare, you had to learn as you go. So overall, it was a pretty horrendous time to be a soldier. And death days after weeks of exposure. Not everyone who came in contact with this stuff died, but it did cause a decent amount of deaths. Not as much as other gases, but it was still significant. It can also cause nausea, diarrhea, and stomach pain. So here we have a pretty famous picture of a soldier suffering from burns and a doctor or nurse looking at it. So let's zoom in here. We see here on the arm some pretty severe burns, some severe burns in here, blisters. Some blisters here and here, blisters on the face. Over time, these blisters would pop up as the chemical kind of seeped through and those burns progressed. This is pretty characteristic of the poisoning, and some blisters right here. Then we have this picture, some more blisters. I just want to show you guys what these things actually look like. This can cover part to most of the body depending on what was affected. And here we have some more. We have some disfigurement as far as the skin is concerned, more blisters. This is personally what was surprising to me. I had no idea mustard gas caused blistering. I'd always wondered why it was so terrible, but as you can see, it's not something you want to go through. Again, one of the many reasons why it is banned, because it's really only used to inflict pain and agony. So one quick thing I wanted to mention is that mustard gas and mustard agents were actually the birth of chemotherapy. In World War II, a lot of civilian and scientific research was connected and intertwined. One of the many scientists that helped progress and study these molecules was a guy named Cornelius Rhodes. Now, he has a very, very checkered history. He did a lot of pretty sketchy, heinous things to people. He was the head of medicine at the U.S. Chemical Warfare Department and the Sloan Kettering Institute for Cancer Research. He did do a lot of race-based chemical warfare tests chemicals on all sorts of people. Seemed to be an incredibly intelligent guy, but had a lot of issues going on. We'll say that. That's for another discussion. He had a scientific interest in mustards and helped birth chemotherapy along with all sorts of other physicians. It's not just him. There are some physicians at Yale, I believe, but overall there was a group of scientists that became interested in mustard compounds. Well, the question is why? There's a whole bunch of reasons. When they would do autopsies on people who were exposed to mustard gas, they saw a couple things: reduced white blood cells, suppression of red blood cell production, and some immunosuppressive effects, which led a lot of scientists and physicians to think about new ways to treat cancer. So you have things like Hodgkin's lymphoma, leukemia, and other lymphomas can be treated using nitrogen mustard. This is very, very interesting. We have a drug called Mustargen, and this is a nitrogen mustard. I just thought it was interesting that we have this pretty horrendous and terrible chemical used to inflict pain and agony that can be used to treat cancer. So I thought there was an interesting like duality there. So I just wanted to put it in here. So let's go through the summary and review what we learned. We first did a general overview of mustard gas. It's a part of a family of mustard agents, sulfur and nitrogen mustards. It causes intense blisters and chemical burns, and it had a heavy use in wars in the past, particularly World War I, with the mustard, garlic, horseradish profile in a yellow color, which is what gave it its name over time. The use has been completely banned: development, use, production, stockpiling, transfer, and it is deployed and has been deployed, I guess, in many different ways. Very, very useful in trench warfare. We learned about how mustard gas changes the DNA structure, resulting in permanent damage that can lead to things like cancer, cell death. It loves fat, so it causes very deep and painful burns when it comes into contact with skin and other tissues. These blistering effects were not immediate. They happened over time. And within 24 hours of exposure, the skin irritation, the itching, and the blisters full of yellow liquid started to appear. In places like Ypres, Belgium in 1917, you had mustard gas being deployed, soldiers suffering in agony, not knowing what they are walking into. This is another painful reality of trench warfare. Then we kind of laid out some of the more physiological effects. We learned about the painful, untreatable blisters, the disfigurement, the intense respiratory burns, blindness, death. We learned that gas masks only did a little bit. The gas can seep through the clothes and can impact exposed skin, causing all sorts of nasty burns. Then we closed out talking about chemotherapy, how the interest in mustards helped birth chemotherapy and chemotherapy drugs. And although that interest was used for some pretty heinous experiments on people, modern chemotherapy did result. And because of that, many people have been saved from many different kinds of cancer. So that's all I got. I hope you guys learned a lot. This is a very interesting video for me because I had only heard about mustard gas. I had no idea what it was or what it did. So as always, thank you guys so much for watching and listening. Please like, comment, and subscribe. Tell your friends, and I'll be back soon with another video.